Hi, you guys. Welcome back for our daily practice questions. As always, y'all know I like to first get into my introduction and disclaimer before getting started with our questions for today. So, for those of you who are familiar with me, hey, y'all. For those of you who are new here, welcome, welcome, welcome. I am Dr. Brittany Weinstock. I am a family nurse practitioner, and I am the founder and CEO of the Nursing Studio. I provide resources, tools, review courses, review videos, Q banks, digital flashcards, one-on-one sessions, and more to assist nurses as well as nurse practitioners with success on their boards as well as in practice. I've been doing this since 2015, assisting nurses and nurse practitioners internationally with exam success. Now, y'all know my disclaimer and reminder is that we know there's no absolutes in medicine. We treat on a patient by patient basis, and any of the questions that you see here, I have designed and created based on the current guidelines that are being tested on the ANCC as well as AAMP exam. Now, any of my videos where I'm teaching on things that we currently do in practice, I will always say that so there's no confusion. So, with that being said, let's get into question number one for today. Question number one states a 27-year-old female calls the office reporting that she missed two active birth control pills this week from her pill pack. She is concerned about pregnancy. What is the most appropriate next step in management? Is it A, instruct her to take one pill immediately and another pill later this evening? In the morning, take one pill, and that evening, take the second pill. Then continue taking one pill per day until the pack is finished. Recommend backup contraception. B, instruct her to discontinue the current pack and start a new pack immediately. C, advise her to take the missed pills as soon as she remembers and no additional precautions are needed. Or D, recommend emergency contraception and advise her to continue taking her current pack without changes. Take a moment and tell me what you got in the comments, you guys. All right, so y'all know I always recommend reading the stem of the question first, as it allows you to slow down to ensure you are answering what is being asked of you. So here, the stem of the question states, what is the most appropriate next step in management? All right, so simply, what are you advising this patient to do? What is the treatment? What is your plan, right? So in this scenario, this is a 27-year-old female. She's calling the office. She's missed two birth control pills this week from her pill pack. So A is going to be your best answer. What you want to tell them to do if they have missed two pills is to take one immediately, as soon as they remember, right? And go ahead and take that day's dose later that evening. The next day, that morning, first thing, go ahead and take that second missed dose. And that evening, you will take that day's dose. And then they'll be back onto their normal routine. Now, as their contraception has been off, due to the missed doses, you do want to recommend they utilize backup contraception for at least 7 days, but they can continue with their normal regimen. All right, question number two. A 22-year-old woman presents to your office for a routine checkup and mentions that she missed one birth control pill this week from her pill pack. She is not sure when she missed it, but she has been taking the remaining pills correctly. What is the appropriate next step in managing this situation? Is it A, instruct her to take the missed pill now, then continue taking one pill per day? B, advise her to skip the missed pill and continue with the rest of the pack, using backup contraception for the next 7 days. C, recommend starting a new pill pack immediately and using backup contraception for 7 days. Or D, recommend emergency contraception as a precaution and continue the pills as usual. What do y'all think? Tell me in the comments. What you think? What you think? All right, so excuse me, what is the appropriate next step in managing this situation? So, what do we have going on? We have this 22-year-old female. She comes into the office for a routine checkup, and during the checkup, she mentions that, hey, I know I missed one of my birth control pills this week. I'm not sure what day because I continued taking it as usual, but I have missed one. So, what would you tell the patient to do? Would you tell her to take the missed pill now and then continue taking one pill per day as usual? Yep, that's going to be your best answer. You want to tell her to go ahead and take it now that we know the missed pills, and then we're going to continue our pills as usual. So she'll take that missed pill now and take her pill for today later, and she'll continue on with her pill pack, okay? And then lastly, question number three, a 30-year-old female calls the office after missing three active birth control pills in a row from her new pill pack. She is concerned about the missed pills. What is the most appropriate course of action? Is it A, advise her to discard the current pack, start a new pack, and use backup contraception for the next 7 days, and advise that emergency contraception may be needed. B, instruct her to take 2 pills as soon as possible and then continue with the normal schedule. Backup contraception is required for the next 7 days. C, recommend emergency contraception and continue with the current pack. Or D, advise her to take 1 pill as soon as possible and she should resume her normal schedule without the need for additional contraception. Take a moment and tell me what you got, you guys. All right, so here the stem of the question states, what is the most appropriate course of action? So what do we have going on in this scenario? In this case, there's a 30-year-old female. She calls the office after missing 3 active birth control pills. Y'all, this right here should tell you instantly. When it's 3 pills, we're not moving, shaking, and adjusting a thing, right? You missed too many pills in this pack. You're going to need to start a new pack. So A is going to be your best answer. You want to advise her to discard the current pack. You're going to prescribe a new pack for her to start. And she definitely needs to use backup contraception for the next 7 days. And also advise that we may need to prescribe or have her to pick up an emergency contraceptive as that may be needed for additional coverage. But you're not going to instruct her to take 2 pills. No, no, no. You're not going to just recommend the emergency contraception and continue with the current pack. She's missed too many. Once you get to 3 pills, that's too far. If they've ever missed 1 or 2 pills, you can adjust it by just as we did in question 1 and 2. But once we get to 3 missed doses, they need to discard that pack. A new pack needs to be started, and additional contraceptive measures need to be in place. Okay. All right. So I wanted to give it to you in all of the tiers because I know we've talked about missed birth control, and in a lot of my sessions, this is one of those things that we get hung up on, I guess, because we often don't see it enough. And then everybody tries to think of their own personal scenarios, etc. So I wanted to kind of give you 3 scenarios in each phase so you can see what to do with it. So as always, I hope you found this helpful. Be sure to like, comment, subscribe, and share with whomever you may think may find this beneficial as well. But y'all know what to do. Y'all make sure y'all meet me back here. And if you need any of the resources that I do offer, feel free to reach out to the nursing studio by giving us a call at 803-400-6864. You can also shoot a text message to this number or shoot us an email to the nursing studio, the number 1 at gmail.com. Everything that I do offer is linked in the bio of this channel, including the website. And if you're trying to book any of the one-on-one sessions, I always say either call, text, or email, as I like to speak with you to gauge what you truly need to make sure you're booking the appropriate session types. All of the resources are linked in the bio, or you can find them on my website. But as always, y'all know what to do. Y'all make sure y'all meet me back here. Happy studying. Bye, y'all.